It's really a pleasure and honor to introduce Dr. Robert Drake. Bob is a physician and researcher who I'm sure is known to many of you. He's the Andrew Thompson Professor of Psychiatry and Community and Family Medicine at Geisel School of Medicine at Dartmouth. I think those of us who know him or are familiar with his work think of him as really truly visionary in expanding the treatment of people with co-occurring substance use and severe mental illness. He's worked with many teams over many years and pioneered truly the importance of employment and a variety of community-based supports in helping people recover and develop stable and productive lives and experience improved quality of life, particularly, again, with respect to severe mental illness and substance use disorders, but across the spectrum of both of these challenges. He's led a number of multi-center studies across the US, exploring the relative importance of a variety of these community variables in recovery from co-occurring conditions. In doing so, he's really transform the paradigm with which we treat people and improve quality of life for persons suffering with these dual diagnoses. Bob founded, I think 27 years ago, the then New Hampshire Dartmouth Psychiatric Research Center, now Dartmouth Psychiatric Research Center, and has served as director of the center for many years, stepping down in the past year. But he continues very active in research and working, some focusing now on exploring the use of electronic technology and shared decision-making between patients and providers. So again, applying technology to really advance the field. So I'm really thrilled to ask Bob to moderate this session, and he'll be introducing the speakers this morning and making a few comments. Thanks very much, Bob.
So I don't know what you would have done if I hadn't said to keep it really short. That's okay. Well, it's a pleasure to be here. It looks like one of our Friday morning PRC centers with a few extra people, and we welcome all the extra people, and please join us over at River Mill any other Friday morning that you would like to. You're always welcome. I just want to set the context for this briefly before we move on to today's talks, because the talks are really exciting. I think you all know that the American healthcare system is expensive, ineffective, and inefficient. You know, probably the worst in the world in many ways. Certainly the worst in the wealthy or high-resource countries in the world. And probably nowhere do we do a worse job than in addiction treatment. We are all hopeful that we're on the cusp of a change as far as that goes. I mean, I think that those of you who work in the addiction field are doing a great job and are working overtime, but you probably also know that, you know, 95% or more of people with addictions get no help at all. Are not in treatment, and the waiting lists are forever in many places around the country. And we really do a very poor job of conceptualizing this problem, a poor job of public education, a poor job of providing access to people who need treatment, a poor job of following people over time, and on and on. The good news is, on the one hand, the Affordable Care Act pushes us towards integrating addiction treatment and behavioral health treatment with physical health treatment, and may make it easier for many people to get access to treatment. Of course, the downside of that is, what would happen if those 95% showed up tomorrow for treatment? There's no workforce there that could absorb the 95% who are not in treatment. We can't even meet at the door and do a good job with the 5% who come in. But the other hopeful sign, which is what our focus is today, is that we really have the possibility soon to dramatically expand our reach, to dramatically expand our effectiveness, to dramatically expand our options for people, to dramatically expand our ability to help people over the long run and to keep track of their outcomes through using technology tools. There are many, many excellent tools now that are available to help people understand their problems, to help people make decisions about what kind of treatment might work for them, to help people enhance or do their treatment on their own at home, to help people through mobile apps to have the supports that are available 24/7 and so on. And this research has been developing over the last 15 years or more now. I think you'll be surprised to hear how extensive the research is. The question for us now really is, how can we embed these things in the real world? In what way are they going to fit into primary care settings, into pediatric settings, into schools, direct to consumer availability, and so on. So I hope you'll be convinced, as I am, that the research is good, and that you'll be interested in helping us think about over the next 5 or 10 years how we transfer all of these technologies to real-world settings.